Well, thanks again. And as I said, this session is all about healthier homes and communities for healthier living. And it wouldn't be possible without the generous support of both Pizzoni Architects, thanks very much, Nigel, and UKRI. Judith, I know you're representing them as well today. So both of you, can I extend a warm thanks for your support for the LIN as well. But without further ado, I'm going to pass over to Professor Judith Phillips, who's very kindly given up this afternoon to chair this session. Judith, over to you.
Thank you very much, Jeremy. Thank you for the introduction and inviting me to chair this final session of the summit. Hello, everyone. I'm delighted that you're joining us for this summit session on healthier homes and communities for healthy living. Before I introduce our speakers, I'd like to make a few comments really to set the scene for the session. I think there are 5 common themes running through this session, and I'm just going to briefly summarize. This is from my kind of perspective. First of all, home and community are inextricably linked into an ecosystem that, as we know, involves transport, health, digital, connectivity, leisure, retail, you can add to it. Yet people need to experience them all as an integrated system. And I think it's really important to stress that. Integration may seem a bit like the Holy Grail if we think particularly around health and social care. It's taken us many years, if at all, that we've actually succeeded in any kind of integration. And I think part of this is because we've actually ignored and not recognized the central importance of housing and homes and community and the importance these have to health. So Healthy Homes and the Healthy Homes and Neighbourhood Bill, championed by our first speaker, Lord Nigel Crisp, I think will make the case very well around this ecosystem. The second point I'd like to make is that the ecosystem also requires an intergenerational and life course approach. How people, as they age, use their environment of home and community, how they shape it, but are also shaped by it. Those of us in aging often look at aging in a bubble of later life. Yet if we are really to develop sustainable housing and stable communities, then we need to look across generations and ensure people are aging in the right place. And frameworks for age-friendly communities, which our second speaker will talk about, I'm sure, is critical to developing this perspective. And to do this, we need, thirdly, to co-design and co-produce our homes and our communities with citizens and looking at the kinds of futures that they want. And I think the work that we're going to hear about from Manchester has really put co-design at the heart of their work. The diversity and intersectionality of later life does actually require us to co-produce if we're going to incorporate all viewpoints. And this shouldn't be tokenistic or tick box, but in-depth and meaningful for everyone concerned. And I think Nigel Saunders' work will actually highlight some of this, challenging those common stereotypes about aging through such engagement with citizens. Fourthly, if we're talking about the importance of the environment to sustain and support aging, then we also have to talk about eco-sustainability. The whole climate change arena has raised its head increasingly, but I think the two agendas of age and eco-sustainability go hand in hand. And if we're talking about the future of homes, housing, communities, that again has to be quite central to our considerations. And then finally, the importance of innovation. We'll hear a lot about some innovative schemes in this session as well. We have considerable research evidence, but how this translates into innovative products and services is really critical. I think in the future, and we're moving towards innovations in AI, big data, smart homes, smart communities. It's really quite exciting, but we need to ensure that the deployment of these innovations doesn't increase inequality. Now, as the UKRI Research Director for the Healthy Aging Challenge, as Jeremy alluded to earlier on, I'd like to share 3 projects with you, and I have a slide showing the 3 projects, which embody very much of what I've just said. And I think the Healthy Aging Challenge aims to enable businesses, including social enterprises, to develop and deliver products, services and business models that will be adopted at scale and support people as they age. So allowing people to remain active, productive, independent or interdependent, as I'd rather call it, and socially connected across generations for as long as possible. It also tries to achieve a narrowing of the gap in the experiences between the richest and the poorest. And I lead the Social Behavioural and Design Research Programme. There are 3 projects within that really centrally address innovation in housing and community. I won't go through them in detail, but you can find them on our website. So these projects involve academics working with businesses to look at collective solutions. In the DESHA project, to look at how we build for people to age cognitively well. In the Enliven project, how to enable access to green sites and take advantage of the visitor economy, again, focusing on people who have cognitive impairments. And thirdly, the Space project, which looks at the impact of air pollution on cognitive health. So bringing that eco-sustainability in as well. Now, I hope you'll forgive me actually for a little self-advertising here, and it's a bit like a commercial break before we get into the main event. Yesterday at the University of Stirling, where I am based, we launched an Intergenerational Living Innovation Hub, which will take some of these innovations in housing and design further and work with businesses collectively, not just businesses, but architects, designers, construction companies, to really collaborate and bring commercially viable and socially viable solutions to housing and community life. And I will post our launch details in the chat. Thank you for allowing me to have that little plug there. So as we move into the main event, we will be moving seamlessly, I think, through our speakers, going from very broad frameworks to tangible, small-scale, innovative examples of healthy homes and communities, and drawing on a number of examples. So our first speaker is Lord Nigel Crisp. Nigel is an independent crossbench member of the House of Lords and works and writes mainly on global health. He is promoting the principles of the Town and Country Planning Association's Healthy Homes Bill in the Lords, a bill that will transform the regulation of built environment to ensure that new homes and neighbourhoods support their residents' health and well-being. Really significant. Lord Crisp was Chief Executive of the English NHS and Permanent Secretary of the UK Department of Health from 2000 to 2006. And he led major reforms in that period, which led to significant improvements in the NHS. He subsequently worked in low and middle income countries in Africa and Asia. And in his discussion, I'm sure he's going to draw on his latest book, so I'll give him the first plug here. Health is made at home, hospitals are for repairs, building a healthy and health-creating society. Nigel, the virtual floor is yours.
Thank you very much indeed. And indeed, that's the title of what I'm going to talk about. It's a great pleasure to be here. I'm delighted to be here, not because I get a chance to speak, but because actually I get a chance to listen. Because one of the things you just said, Judith, which was really important, is health people don't often think about housing, or don't think enough about housing. Those working in mental health are more likely to do so than those working in acute sector in physical health. And I'm on a learning journey here, so I'm looking forward to learning from listening to colleagues later on. And let me also just congratulate Jeremy and his team for a great event. It's obviously been a great week, but also for 10 years. Startups that survive 10 years are always a good thing. So my congratulations on that. As you said, my background's the NHS and more recently in Africa. And indeed, I'm going to share my screen now, if I can manage to do it okay, wherever I can find it. Here we are. And you can see the Health is Made at Home Hospitals of Repairs statement, which comes from Africa, comes from a great friend of mine, Francis Amazwa, who was running the Ugandan health service at about the same time as I was running the English one. And it's a great saying, isn't it? Because it reinforces all those points about the social determinants and so on, and our recognition that only 20 or 30% of our health is determined by what happens to us in the NHS. But it does something else as well, actually. Health is made. It talks about creating health. And I'm going to talk quite a bit about creating health. And that means thinking about the causes of health, not prevention, it's important, but which is about the causes of ill health. This is about the causes of health, and the causes of health are contained in a lot of the things that Judith already talked about, including that very first one about the integration, if you like, of home, community and health, and the health of the individual is intimately connected to the health of the community. So let me try and move on, if I can work out how I'm going to move my next slide. So the first thing I have to do in doing this is take off my NHS spectacles, get rid of all my preconceptions, all that sort of stuff that I've had for years, and think about life differently. And to some extent, what I'm going to be talking about here is a celebration of the health creators, and indeed explaining what I mean by health creation and who the health creators are. A bit about the NHS and the different roles the NHS, government and the general public, civil society have, and a reminder that if we didn't need to know it, if we didn't know it already, the NHS can't do everything by itself. So the health creators. Now, health creators are bringing about new ideas, new and old ideas, I should say, about creating health and about the quality of life. And that's being what our work in health is all about. Now, the really big point here is this is not social prescribing, and it's not engaging the public. I've met lots of local communities over the last, virtually over the last year since I published this book, actually, and I hear the authorities, whether the health authorities or planners or whoever they are, talking about sometimes the difficulties of engaging the public, and I hear the local community groups saying, God, it's difficult to engage the health system or to engage the planners or whatever. They're just not listening. And it's a really quite an important point there. But the other point about social prescribing is social prescribing is great, but it's about looking after individuals, and it's also rather top down. And everything that I'm talking about with the health creators is not top down. It's about taking control. It's about people doing things because they want to do them, not because you in the health system or whatever have decided you're going to engage them and involve them in it. So it's not business as usual. I'm reminded of the fact that it's in the 1970s, I worked for 5 years as a community worker for a charity in Liverpool, actually in Halewood, if anyone knows it, Overspill Estate outside Liverpool. And one of the things that we all talked about then was non-directive leadership, being an animateur, leading from behind, as it were, getting things going and being, if you like, agents of change. And I think when we're talking with the health creators, the professionals, I'm talking here about specifically the health professionals, but I think others as well, need to be in that role of being agents of change, but not dictating the change, enabling, supporting, influencing. So what do I mean by health? Well, this is the World Health Assembly definition of 1948. Health is about physical, mental and social well-being. It goes on to say, and not about the absence of disease. Well, it's taken us 100 years since Freud and Jung and people were writing to more or less get to parity of esteem between physical and mental health, although many people, we've got that in policy, even if it's not in practice. And we're going to take some time yet before we really understand how we integrate our increasing understanding of social well-being and how we get that much more clearly into our focus. When I think about health, it's actually, I think, more than that now. I think there's an ecological aspect here that I won't attempt to go into. But if I think about health and well-being, actually being healthy is about our life and our freedom and our confidence, the quality of our lives. Fundamentally, it is about our relationships, how we live and what happens to us at work and at school and everywhere, the social aspects. It's about being all that we can be and living life to the full. And when I think about creating health, what I mean by creating in health is providing the conditions in which people can be healthy and helping them to be so. And my paradigm for this is a parent. Hopefully that's what they did for us. Hopefully that's what we do for our children. It's what a good teacher does, what a good school does, what a good community does. Actually, to some extent, it's what a good building does as well. Seeing Nigel as an architect on this panel. It's about helping create resilient, confident, capable and healthy individuals. And those things all go together. Health isn't an add-on somehow to real life. It's absolutely part of these other important aspects. And I think of it in terms of human flourishing. And as I've said already, the causes of health, not the causes of ill health. And there's a lot of history here. There's Salitogenesis, which some people may be familiar with, developed from the 1970s onwards. Salitogenesis meaning the beginning of health, and the opposite of pathogenesis, the beginning of disease. Or eudaimonia, which is Aristotle actually, from 2,300 years ago, talking about the good life, and that normally translates as human flourishing. There's traditions here we can build on from other parts of the world as well. But there's also science, and there's enormous amount more science all the time about what being in a green environment does for us in changing our mood, in changing us physiologically, what relationships do. These are really important. We all know that loneliness is an emotional problem, but when you become socially isolated, that can lead on, it could be a forerunner for dementia and so on. And those people talking about care for older people or housing for older people later on will no doubt be much more expert than me on that. And of course we know about exercise. So there's history and there's science in all of this. So I now think about health and well-being in three buckets, if you like. Firstly, the health services and healthcare, the responsibility of the professionals. We can help them, but let's leave it to the brilliant professionals that we've got. Prevention and protection, very much the responsibility of government. Although again, we've all got a role in this, and that's about the prevention of disease or accidents. And then health creation, which is very much the province of civil society. It's the employer, it's the school, it's the educator, it's the family, it's the community. It's the police force, as I will mention in a moment, and lots of other people. So if I just refer to you to quickly about three groups of health creators, I interviewed about 60 for the book. And just to pick out a few very quick responses here. Firstly, Bolton at Home. I know we've got Manchester people on the panel. They seem to me to be an excellent housing association who've done an awful lot around health, some of which is around preventing falls in their homes and those type of activities. But a lot of it seems to me to be about preventing isolation, supporting people, linking people up, doing things that actually create a place where it's worth living, where it's good to live, where it has an impact on people's health and well-being. The TR14ers, a policeman down in Camborne at the bottom tip of Cornwall, who 15 years ago got fed up with chasing young kids for vandalism and minor crimes and instead started to work with them. And as a result of that, they decided between them to start a dance club. That dance club's been going now for 15 years. 3,000 young people have been through it. University of Exeter has demonstrated that it has improved health and well-being, and it's also had an impact on crime, as you may imagine, within the system. Nothing to do with health in a way, but actually what he was doing was ending up creating health, creating a place worth living. And the sewing rooms, going back north again to Skelmersdale, a woman there who decided to set up a community business sewing, which brought together isolated women. They ended up having things like the silver sewers, which were older women coming together, stopping isolation. They brought in refugees, actually, and Syrian women refugees sewing together, talking about recipes and so on, integrating more into the community. These were all people who were creating the conditions for people to be healthy and helping them to be so. And the big point I want to make here, having rushed through that a bit, is just to pick out some of the behaviors. In my book, I pick out 10 behaviors that people, that is typical of all of these people I talk about. I'm going to mention just 4 of them. Firstly, mental health. All these groups deal with physical and mental health together. There's no separation there as we separated in the NHS. Secondly, they all start with relationships. They don't start with job descriptions and saying you've got to get X and Y and Z together. People coming together, deciding they want to do something, doing it. And then of course you need systems and business plans and all the rest of the paraphernalia that we have in our systems. Coming down to the bottom right-hand side, the last two are the other two ones I want to just pick out, about how important it is to be entrepreneurial, to learn by doing. There aren't plans for doing these things. You may set off in that direction, but actually you need to shift quite quickly. But you've kept your purpose in mind, your purpose-led, vision-led, not plan-led. And the final point here is about taking control, but I've already covered that. So within that, we've all got roles in building a healthy and a health-creating society. And in the time, I'm just going to pick up, there are opportunities and problems in this. We, as health creators, we as the NHS, we as government, have different language and different emphasis on systems, business planning, contracts and science. Government has its politics and its silos, and there are challenges and opportunities. And a lot of the work that needs to be done is how do we bring these together to create some kind of partnership that is able to deal with the three parts of health that I've talked about. And let me just then touch on the thing that Judith mentioned, which was the Tcpa Healthy Homes Bill. It is I think, an interesting bill. It puts on a requirement on all developers to promote health, safety and well-being. It sets out some standards. You have to produce an annual report from the Secretary of State to Parliament, and there's a Healthy Homes Commissioner. Now, it's a private member's bill, so it isn't going anywhere. We might bring it back at some other point, but it won't get into law unless for something very odd happens. But the principles in it, we're trying to insert in Parliament into other bills, including the Building Safety Bill, which is just there, as you will be aware now, including whatever comes up from levelling up, and of course also when or if the government ever brings anything back on planning. But these principles can be inserted into these bills. I think it's really important, and I hope it will take us forward. But my final point is this one, which in a way I started with, Judith started with as well. Our health as individuals is intimately connected to the health of our communities, to the health of wider society, and ultimately the health of the planet. All of these things go together, and actions to deal with one of them need to address the others. And then finally, my advert, if I may, if you'd like a copy of the book, you know, it's now on the slideshow. So thank you very much. I hope that gave you the big picture you were looking for, Judith. And I look forward to very much to listening what colleagues have to say. Thank you.
Thank you very much, Nigel. That was inspirational. And I'm agreeing with people in the chat saying they're definitely going to go out and buy your book. So it's fantastic. I really like the way that you placed the your discussion on the kinds of everyday life and relationships, and I think that's really important, and flipping that notion or concept of prevention more to about creating health and putting the emphasis there. I think that's given us a really good start to where we should be heading. So thank you again for that. Yeah, we do need both. Yeah, but very often we just think about prevention and we don't think about creating health in the way that you've described. So thank you for that. So we'll now go on to our second speaker, who is Nicola Waterworth. And Nicola manages the Centre for Ageing Better's strategic partnership with the Greater Manchester Combined Authority and is based in the Greater Manchester Ageing Hub. Nicola works as part of the Ageing Hub to deliver the priorities of the Greater Manchester Age-Friendly Strategy that I mentioned earlier on. And this supports older people in Manchester to enjoy later life and enter later life in safe and accessible homes that support people to live independently. And Nicola has produced with others the framework for creating age-friendly homes, a study of realising the housing aspirations of those in mid and later life within their communities. And that's due to be published, I think, Nicola, early next year, if that's correct. So over to you, Nicola. Thank you.
Thanks, Judith. I'll just share my screen. So yeah, the framework for creating age-friendly homes was actually published in September. So I'm going to talk about some of the strategic work that this framework represents that we're that's happening in Greater Manchester to create age-friendly homes. And I think that will pick up some of the key themes that we've just heard about, and also complement the presentations that will look in more detail from other colleagues in Greater Manchester. I think while the lens I'm using on this is age-friendly, I'm not really going to focus on the why we're doing this or the what so much of our work. I think what I want to do is pull out some reflections on the key themes of how we're working in Greater Manchester to influence and create the conditions for change, and give where I can some practical examples of that work. And obviously it's not exclusively a case study around health systems and the ICS, but I think they are a part of the work that we're doing. And I think some of this will really speak to those, the part of the agenda around building effective strategic partnerships. I think it goes without saying that the model in Greater Manchester is not perfect, but I'm hoping that some of these reflections are helpful to colleagues. I think the key themes that I've been reflecting on quite a lot are how we build that collaborative cross-sector leadership and partnership, how we develop and use the data and the evidence base, and really creating that compelling narrative and shared ambition to change the culture and therefore ultimately deliver the impact on the ground. Oh, a bit quick there. Just briefly some background. Hopefully most people on the call are aware of the Centre for Ageing Better and our work. People may be less aware of our strategic partnerships and work in localities. These are where we work closely with Leeds City Council, Lincolnshire and Greater Manchester Combined Authority, and also through the UK network of age-friendly communities. That really helps us to understand how we create better later lives in the places that people live and with those local stakeholders. Our partnership with Greater Manchester has been in place since 2016, and homes and communities has been an important part of that shared ambition with Greater Manchester since the start. And nationally, homes is a central priority for us at Centre for Ageing Better, and just hopefully people are aware of our two most high profile pieces of work in this area around the Good Home Inquiry and the Home Coalition, both of which have been informed by our work in Greater Manchester. So Greater Manchester's fairly unique as a city region in having an ageing hub. This is a partnership and a small team based at the Combined Authority, as it says here, responsible for coordinating a strategic response to the opportunities and challenges of an ageing population. That overarching role, I think, speaks to something that's already come up here, which makes the strategy and agenda of the Ageing Hub inevitably very broad and highly diverse, but also creates those opportunities for strategically joining up policy and practice around the whole person and the reality of people's lives. Housing and homes has been a priority throughout the life of the Ageing Hub, and the Housing Planning and Ageing Group, which has really been driving this work, was established in 2017. So on to just provide a little background about the framework. In early this year, we were looking at progress on the goal around increasing the numbers of age-friendly homes, and our reflections were that there were, good examples of innovation and good practice and impact in both new developments that we were seeing, and also work with existing homes and communities. We had a really well engaged partnership and a considerable evidence base and research, much of which Greater Manchester had developed or been part of developing, and telling us around what needed to happen to create change. What we knew less about was how well the work was influencing a broader range of stakeholders, and what those working in local authorities, the housing providers, developers were thinking about their direction of travel in relation to ageing and the homes and communities that required. And we wanted to understand more about what key stakeholders needed to progress the agenda, where they thought the opportunities were over the next 3 years to deliver greater impact. So we commissioned Helen Bosowski at ARC4 to engage with stakeholders and seek their views and deliver back to the Housing Planning and Ageing Group recommendations on what we should be doing over the next 3 years. What was really great about the process is that we heard back about the energy and motivation there was for this agenda, the keenness to be delivering, and a real drive to look at how ageing needed to be connected to or embedded in so many other related agendas, be that the retrofit and net zero, affordable homes, tackling health inequalities. And what resulted was the framework for creating age-friendly homes for Greater Manchester, which you can see our fabulous cover star Mindy here from Greater Manchester. And just to kind of pause a little bit and comment, it was really important to us, which I think picks up on a theme that's already come up, that when we designed this document, we thought a lot about bringing people into that document. We didn't want a document that had solely pictures of buildings. It has got some beautiful pictures of buildings and developments in it, but we really wanted to kind of centre this about it around people. And I think we've achieved that with the cover. But the framework, what it does is set out the shared ambitions for homes and communities. It identifies a long-term vision for outcomes for people in mid and later life, and 5 strategic themes that are the priority for the next 3 years. There's a line in the framework that I think encompasses a lot of what we're trying to achieve with this, which is we're seeking to achieve a permanent cultural shift around housing in later life. And it really, I think, offers to stakeholders that clear direction of travel around which partnerships can occur, they can mobilise and influence, setting out the expectations for Greater Manchester and the way in which we'll do this. So themes like, again, picking up on what's already come up really, include how we work with residents, how we co-design, co-produce the homes that we want to see. And as you can see there on the slide, that's the vision. The 5 key themes that will shape the work over the next 3 years, I'll just cover briefly. Embedding ageing in all the housing strategy and delivery work in Greater Manchester. This framework is already aligned with a number of key Greater Manchester strategies. What we need to do is look at how it's really, I think about it as wired in to all the relevant strategy and plans and decision making at a neighbourhood level, at a local level, and at a city region level. Be that housing strategies, health strategies, population health, what are the, we need to understand what the links are in that territory. Secondly, resetting the conversation. So changing the narrative on ageing from valuable, not vulnerable, is a really central pillar of all of the Ageing Hub's work. In this priority theme, we're really particularly thinking about how we can work alongside developers to do this, and that's the focus of that in this framework. Making an impact on the ground, obviously that was included in the title of this session. Much of our stakeholder feedback was about how we take that evidence and good practice and create wider, greater impact on the ground. So what are the tools, resources, support and value that we can bring to partners to enable that change to happen? Is really what that strategic theme is about. Promoting Improve or Move certainly covers the ground of the Good Home Agency model that was proposed by the Good Home Inquiry, was commissioned by Centre for Ageing Better, and the role of home improvement. I think Greater Manchester is well positioned in this area with leadership on health and homes from the Health and Social Care Partnership. But there's also some more scoping to be done here about ideas around innovation in financing and supporting people to move earlier, and consumer-facing behavioural work as well. And the 5th priority really sits at the heart of all this, about engaging people and sharing practice. And then there is the idea that there will be developed a Greater Manchester age-friendly housing charter that underpins all of this work and sets out what good looks like for the partners. So I just thought it'd be most useful to reflect on these three key enabling factors that I think the strategic work in Greater Manchester is delivering. Firstly, this collaborative cross-sector leadership and partnerships. The Housing Planning Ageing Group is chaired by Karen Mitchell of Southway Housing Association. They're a housing provider doing really innovative work in both the fabric of their homes and the social infrastructure of age-friendly communities. It has representatives from across the Combined Authority, the Health and Social Care Partnership, our ICS to be, particularly the Healthy Health and Homes Group, and links to Greater Manchester's tripartite agreement, which is an agreement between the Combined Authority, the Health and Social Care Partnership, and our housing providers. There are private developers on there, private providers of accommodation services, care and repair. We're there as a Centre for Ageing Better. Jeremy is there with us from HousingLIN, as well as Manchester School of Architecture and academics. Importantly, we also have really strong links with the Greater Manchester Older People's Network. And I think what that's enabled is the things there that I have highlighted on the slide around developing the ideas and thinking, giving that space to understand the evidence and the research. And really, I think that's put us in a strong position to understand what good looks like, how we make the case to key stakeholders, and ultimately how we build that movement that will influence and impact on building more homes. Just pulling out 3 examples really of, I think, where that partnership is demonstrated. So our Greater Manchester housing providers now have an age-friendly network amongst them. So that's a lead at each of the housing providers that with a focus on this agenda. And they're looking at their contribution as a sector to delivering on this framework. We're going to hear from Nigel. One of the many things that Nigel contributes is around developer roundtables. So thinking about how we can have conversations directly with developers that are targeted at them, creating that space for conversation. And also, this will be my plug, but it's not for my work, it's for a Design for Life from Manchester School of Architecture, and also Pizzoni, which is really setting out some of those examples of what good looks like locally, but nationally and also internationally. Second enabling factor, I think, is around developing and using the evidence base. Again, I've highlighted here a few key examples that demonstrate the breadth of how we're trying to do that, and both develop new research and evidence, but also use what's being done nationally, obviously through things like the Good Home Inquiry. The Greater Manchester Older People's Network is an example of where we're working with older people in Greater Manchester. They're currently doing some research around information and advice services that we're looking forward to hearing the results of in the early new year, and how we incorporate that. Right Sizing, hopefully, is a publication from the partnership as Ageing Better with Manchester School of Architecture, people are familiar with. We will next year be publishing a further piece of work called Right Place, which will look further at how in a local area we really look at the housing offer for people in mid and later life to meet their requirements. We've looked at regeneration, and colleagues have already flagged the publication this morning of the Housing and Living Well with Dementia report with the University of Manchester. So I think it's really important that we have that data in the evidence base. But a huge part of this for me is about how you build the movement, bring more people with us or go to them, but whichever it is, it's about influencing decisions about how we build homes and communities. We have this extensive research and evidence base. I think it's critical that we create a compelling narrative and build shared ambition so that there is that movement to deliver impacts on the ground. I'll just put out a couple of things. So we're working on an engagement plan. One of the things we're doing is user testing kind of messages with elected members and with planners to how can we incorporate a lot of research evidence into kind of package it up so that we can really engage people in that. That's an important part of our work. And also, how can we bring more voice and experience of people in mid and later life into that engagement work that we're doing? So those are two real priorities. And finally, I call this challenges and opportunities, and I doubt there's much on this slide that hasn't featured kind of most of this week in a number of sessions, and I'm not particularly going to go into all of these. I think they're kind of things that are on my mind that I'm thinking about. I think the two that I just pull out is in terms of a practical sense of how we're creating that movement and that change. I'm interested in how we get the balance right between the tools and the evidence and how we share that with people, whilst also enabling them to create what they need to create in the places and communities that they're in. I think there's a real trick there about getting that balance right. It's not a lift and shift, and I think we all know that, but then what are the kind of enabling tools? And I think thirdly, those consumer facing conversations, behavioural change elements. I think it's early days in Greater Manchester, but we're talking about, we have a colleague in Stockport particularly who talks about big conversations with people. So that might be about thinking about our homes earlier in life, and what they might look like as we age. But for other colleagues, it might be conversations about active travel in their communities or community well-being. And I think that's a really interesting space that we'll be looking at more in the coming years. So I hope that's been a kind of thought-provoking, if rapid, introduction to the work we're doing to create those kind of partnerships to deliver those communities that are healthier.
Thank you, Nicola. That really was a very helpful overview, I think, of what's happening in Manchester. And you've raised a lot of questions and ideas for people, I'm sure. As you were talking, it made me think how we've come a long way, actually, since the WHO set up the age-friendly network and the age-friendly cities initiative. And very much it was a tick box exercise seen by many at the start, and how you've really embodied all the kind of things in Manchester, and really taken it to another level, of course, and really created age-friendly Greater Manchester. And it's wonderful that so many people are working in this space. And also the importance of strategic partnerships. That's what strikes me very clearly, that it's that strategic partnership and champions amongst the citizens of Manchester as well. And, you know, enabling everyone then to change the narrative to valuable, not vulnerable. I think that's great. So thank you very much for that. And just a plug to keep putting your questions in the question and answer box, if you may, and we'll pick those up later. Okay, over to our third speaker then, Michelle Humphreys. Michelle is the Director of Strategic Projects at Manchester University NHS Foundation Trust. So we're sticking with Manchester here. And that's one of the largest NHS trusts in England. And her role at the trust focuses on the forward strategy of the trust's estate, which includes 10 individual hospitals. Amazing. And this includes the proposed whole-scale redevelopment of North Manchester General Hospital site, which has been identified as a pathfinder within the government's new hospital programme. Michelle, like me many years ago, is a town planner with a 25-year career working on regeneration projects from both public and private sectors. And Michelle is passionate about supporting communities, creating better places and ensuring equal opportunities for all. And she's encouraged diversity in the construction industry, wow, and has created work experience and apprenticeship opportunities for local people in her professional role. So Michelle, we look forward to hearing from you. Over to you.
Thank you. As I just try and share my screen. There we go. Thank you very much, Judith, for that. Yeah, so I work for Manchester NHS Foundation Trust, as Judith said, and we always like to say that we're one of the largest NHS trusts in the country. and I must check actually, because I'd like to say that we are the biggest, but I'm not 100% sure on that. But the idea behind creating Manchester University NHS Foundation Trust, or MFT, I maybe refer to it from now on, was the fact that there were 3 acute trusts in the city of Manchester a few years ago, and as part of the devolution of health and social care in Greater Manchester, the kind of Devo-Manc deal a few years ago, there was a real drive to create one acute trust for the city of Manchester and Trafford, so that all residents, could access the same level, same quality of services across the city. So that the MFT has been created in 2 stages. Firstly, the merger of Central Trust with University Hospital South Manchester in 2017, and just this year the acquisition of North Manchester completed in April 21. So as Judith said, we're now responsible for 10 hospitals plus the community care in both Manchester and Trafford. So this really gives us an opportunity for transformational change of health and social care in the city, and we're all about joined up services, integrating. I think we started talking about integration, didn't we, at the top of this session. So yeah, we need to make sure that the future is a digitally integrated health economy, and we can't do that alone. We work very much in partnership with our health and social care and economic partners in Manchester and Greater Manchester. So there's a list of our many hospitals, say from Wythenshawe in the south of the city to now North Manchester in the north, and everything in between, and those local care organisations as well. And just in terms of Manchester, and I guess the challenges as part of our service delivery and transformational, thoughts in terms of the future and how we should be shaping services, are of course the health indicators that we look at in Manchester. And this just shows some of the key ones in terms of the England figures and then the Northwest figures, and then how we compare to some of our neighbours as well. And whilst there's been great economic activity and progress within the city over many years, for people who know about the regeneration of Manchester, there are still many challenges in terms of some of these key health indicators. And then actually, if we drill down into North Manchester a bit further, there are further specific challenges in this part of the city when we look at that as well. Residents of North Manchester continue to experience some of the highest rates of deprivation and poor health across England. Several neighbourhoods are in the top 1% most deprived. And of course, that has many implications in terms of employment, child poverty, education, and in terms of all the factors that kind of make someone's health interesting, in terms of what Lord Chris was saying earlier on, and a lot of that resonated in terms of the range of issues that we face. Specifically in North Manchester, there's, as I say, the life expectancy is lower than Manchester and the UK average. The boys born elsewhere in England have a life expectancy 5.1 years lower than in North Manchester compared to elsewhere in England. Child obesity rates, cardiovascular disease, respiratory diseases, alcoholism, etc. Just a range of poor health outcomes. And as we thought about how we would transform North Manchester General Hospital, clearly these are major indicators for us to think about. And also, I guess there was major consensus with partners that the hospital estate itself was in a poor state of repair. These are Victorian workhouses that we're currently delivering clinical care in, 1860 and 1870. Not capable of delivering modern healthcare. Many challenges over the years, having to close various wards due to fire regulations, asbestos, and just the failure of the old M&E systems, water systems, etc. 70% of the existing estate is in a desperate need of repair, and we think this clearly has an impact on many things in terms of our ability to deliver quality services, but vacancy rates as well in terms of being able to attract and retain staff. So this taking the health outcomes issue and the hospital estate itself, and here it is. Any of you know Crumpsall in North Manchester, but you can see the kind of the old Victorian crucifix form there, and the sort of the nature of the site. So it's one sort of main hospital down the spine there, and the old HQ, the work that was the original workhouse in the foreground, the sort of longer building as well. We share the site also with Greater Manchester Mental Health Trust as well. They have a facility on site, and that is part of our redevelopment plans as well. Again, we can't do this alone, and we're working very closely with the MHCC, the commissioners, the local care organisations, clearly the City Council, major partner, the GMMH, the Mental Health Trust, which we share the site with, and the B is for Bruntwood. They're our strategic partner. They're a partner with MFT for 10 years. This is part of something we wanted to do 5 or 6 years ago after the success of one of our partner projects, which was City Labs, focused on providing space for biomedical research. So as an NHS trust, we wanted to continue that work with Bruntwood to look at ways in which we can be innovative and get closer to the private sector. So they remain our partner, and we worked with them when we were developing master plans for our sites. So what we think about in terms of North Manchester, in 2019, partners came together, I say, taking the sort of health issues and the state of the estate into account, wrote the Future of North Manchester General Hospital Site, a healthcare-led approach to civic regeneration, known as the proposition, because that's quite a lot to say. So, and this just really set out the challenges in North Manchester in terms of employment, education, housing and community cohesion, and started to set out a plan. Now, this clearly landed in the right place at the right time, because within months we had the Prime Minister stood within North Manchester General Hospital saying that we would, be part of the new hospitals programme and, be receiving significant investment into that site. So that was a really key kind of opener for us. The strategic aims of what we're trying to do at North Manchester are wide-ranging. So, of course, it's to build a new hospital, but we felt that the promise of that scale of investment into this part of the city, we had to make sure that it was actually a catalyst for wider regeneration. So really, it's about an inclusive economy. Of course, it's about health outcomes. It's about sustainability in terms of the building, but in terms of transport options as well, investing in education, neighbourhoods of choice, which is, of course, the bit that I'll start talking about a bit more, and the net zero hospital. So, a wide-ranging set of aims for us, but we truly believe that this, the scale of investment into the site will need to have an impact on all those aims. So the master plan itself, I won't go into too much detail, but it really is to transform the site. It's a full master plan, and it's based on the sort of cost envelope that we believe we will get from the hospitals programme, and on that basis, it's a significant new build with some refurbishment of existing, some of the newer bits of the hospital. So not the Victorian bits, but some of the newer 80s, 90s bits. But what we wanted to do is really take the master plan as a whole. So what could we do with the hospital as obviously as a key anchor? But then it's a large site. There's opportunities to free up some of the sites, think a bit differently about uses on the site. And as you can see here, we were thinking about the acute facility, but then an education hub that would serve the needs of the NHS, but also be very much outward facing to the community, be open for use with schools and colleges, and community use. A car park, which is essential, but to make sure that it has a cycle hub and gives other transport options as well. The mental health facility that I talked about is also being rebuilt. That has just got its final business case approval. So that moves from its current bit of the site to the yellow bit of the site there. So everyone's kind of moving around, but it does give us a chance to refresh. There's an integrated admin hub, so not just for the trust, but for other organisations as well. And then the key bits, I think, for today are the village green in the middle there, number 7. So where the current Victorian estates currently sit. That's a significant area of open space. It's the size of Piccadilly Gardens in Manchester, if anyone knows that. But we really want to make sure that that has a number of ways in which it can be used, so not just for patients and staff, but for the community on a day-to-day basis to come onto site. So you normally only come onto site if you needed to go to hospital, quite frankly, but really, how can we use that space to create facility for local people? And how does that speak to number 8 there, which is what we call our healthy neighbourhood? So this is an area of the site which currently has the mental health facility on it, but is close to the existing housing next door. And so this was the area we really focused on for our healthy neighbourhood. And that was never about selling the land off and inviting a private developer on the site. Firstly, that we just wouldn't get the cost of land, or the value of land in North Manchester wouldn't make that attractive anyway in terms of the receipt. And we thought actually there's a better way. There's a longer term plan here that we can use, which will add more value to the NHS in the longer term. And that's where we started thinking about what type of housing should that be? How does it relate to the hospital? So that was the origins of the healthy neighbourhood. That master plan is now enshrined in a strategic regeneration framework. It's approved by the City Council. We did extensive public consultation on that, and obviously with stakeholders. So we're starting from a good point now in terms of the consensus around that master plan being the right one. And this is kind of what it looks like. You know, the architects love the CGI. So this is the same orientation as the original plan, but shows the new hospital, the village green there in the middle, and the healthy neighbourhood then off to the left-hand side. So the healthy neighbourhood itself, we want it to be a place where community wellbeing and regeneration seamlessly interact to generate health, social care, and socio-economic improvements. So you can see there that in terms of the purple sections and how it relates to the local existing park. Now, currently you can't walk between the park and the hospital. You know, there's big fences, and there's a bit of a gradient as well. So really opening up the site and making that feel part of the existing community, and how we can really create an intergenerational mix there on the site. We're thinking about, I say, how it relates to the hospital. So why would the NHS Trust be sort of thinking about a healthy neighbourhood? Well, it brings accessible wellbeing and healthy living services to North Manchester. That's important to us. Obviously, it aligns to the NHS long-term plan to support out-of-hospital care. As we know, unsuitable housing costs the NHS £624 million a year. So really, it makes sense for us financially, but in terms of health outcomes and where people should be receiving care, whether that's, you know, additional step-down care, whether it's different types of housing. As probably you're aware, there's transfer delays seem to increase year on year. And so again, how can different type of housing help us in terms of those bed pressures? Basically from a design assumption point of view, in terms of what we're proposing for the hospital, you know, we need to build the smallest hospital that we can. It's a very expensive building. It's massively engineered. And so are there uses that actually don't need to be in the acute hospital and could be delivered in a different way? And so within the healthy neighbourhood, we also have a health and wellbeing hub as well. So starting to look at how services can be spread and how the housing really can link into that. Complex needs in the North Manchester community, we're just getting under the skin of that really. So potentially a range of care accommodations, so something that is flexible and diverse, that can really add quality housing to the North Manchester supply. Potential key worker housing, I say, and how that relates to the Village Green proposal as well. We also have a proposal within that bit of the neighbourhood, is proposal for the International Centre for Healthy Ageing for Greater Manchester. So there's a lot going on in that area of the site, but really interested in how it could all link together and support each other. Also to mention that as a trust, we also have Wythenshawe Hospital, and again, similarly, we've been working on the master plan for Wythenshawe as well. And just to say that it's a really similar approach here. You know, it's about retaining hospital services, but creating a mixed-use development with a redeveloped hospital at its heart. Wythenshawe's a completely different proposal in a way. It's very close to the airport. HS2 is due to come next to the airport in terms of the airport hub there. So really more opportunities for things like research and development, but we also wanted to make sure that we've got the same kind of housing focus as well. This is the existing site. As you can see, there's this is more of a 1950s, 60s style development, not as old as North Manchester, but still, you know, coming to the end of its of life really in terms of modern healthcare estate. And again, we've just zoned up the master plan in terms of what we could do in the future, focusing the clinical accommodation to the north of the site, creating a research and development zone in the middle, and then that healthcare residential down at the bottom of the site, which links into a proposed major site for residential, Timpley Wedge, if anyone knows that as well. So that isn't a white block underneath us, that is actually a major development in its own right as well. Another architectural CGI about what Wythenshawe currently looks like, and then what we think it could look like in the future. So as you can see, major ambition for Wythenshawe as well. It's North Manchester that's part of the new hospitals programme at the minute, so that is that's being driven by that, and we're looking at ways in which we can unlock investment in Wythenshawe, potentially working in partnership with Bruntwood. We do need to carry on working with government to make that happen. But these are our longer term ambitions for Wythenshawe. So give you a flavour of what we're doing at MFT. But yeah, over to you, Judith.
Thank you very much. That was fantastic, very exciting, and very interesting to see how you've transformed a hospital site to really be embedded really centrally and bring the community in, and really an anchor for regeneration, as you mentioned. So, so some great examples there, and lots of ways in which you're changing the narrative around ageing as well, I think, to pick up Nicola's point as well, through healthy neighbourhoods, intergenerational mixing, and changing what I guess would have been quite a stigmatized area with a workhouse. And we know how, you know, people used to view those kind of hospital areas and estates and so forth. So that was tremendous. Great. Thank you very much. So finally, on to Nigel. And Nigel Saunders is the director at Pizzoni Architecture, and again, very well connected with Manchester. Nigel has expertise within the housing sector, designing schemes for all age groups, and he's passionate about creating residential communities and promoting neighbourhoods with balanced demographics, which play a key role in delivering social benefit. He's been one of the driving forces behind Pizzoni's designs for theoretical mixed use urban community, with housing for all ages alongside care, leisure, learning and other supporting facilities. And I'm sure he's going to talk about that. He also is part of the Great Manchester Combined Authorities Ageing Hub. Everyone's going to want to come and work for that now, which actually aims to enhance the city region's housing options for older people. And he has recently co-authored a Design for Life Urban Practices for an Age-Friendly City, which I think you saw, I think it was on one of Nicola's slides. So over to you, Nigel, and look forward to hearing what you're going to say.
Thank you very much, Judith. Thank you very much. Okay, so just a little bit of background to us as a business. We're a national architecture practice with 2 offices, one in Manchester, as you might expect, and also in London. We cover a very broad range of market sectors, but in relation to today, we have a particular specialism in designing housing really for all stages of life, but in particular later life. I'd like really just to cover 2 main areas in my slot today. The first is around defining what we mean by a healthy neighbourhood, and the second really is to illustrate how that thinking is being applied at an early stage in the North Manchester General Hospital project, which obviously Michelle, thank you, has explained the background to and set the scene for very well. So if I move on to what we mean by healthy neighbourhoods, well, we believe healthy neighbourhood is really one that's focused very much on supporting people's well-being. That's in creating strong and well-connected communities. So we mean by that, we mean sort of inclusive environments with well-designed and appropriate housing, along with, I suppose, all the infrastructure that's required to help tackle the root causes of ill health and poor health and low quality of life. So things like access to good employment, access to healthcare, amenities and services, and that in designing healthy neighbourhoods, we need to make sure they're underpinned, if you like, by a range of principles that support the and promote good health. So, for example, neighbourhoods which are sociable, they're vibrant, with good community facilities, neighbourhoods that work with the natural environment, have strong landscape design, networks of connected spaces, a variety of uses, be that for recreational sport, active travel. So active travel, I mean things like walkable, cyclable routes, easy access to public transport. And then perhaps thinking a bit further in terms of opportunities to influence health through growing food locally, which may also impact on fostering biodiversity, and lots of considerations, I think, around landscape and design. In terms of the design of homes, well, the home itself, there's loads of great stuff out there in terms of guidance, but flexible, adaptable homes for all ages, which offer, a mix of types, a range of tenures, homes which enable independence as people age, allowing them to remain and age in place, which is so important. Housing types that allow people in later life to access to care they might need as their circumstances and health needs change, for homes to be affordable, families, key workers and supported living. And also, I think the sort of internal living conditions, so the design of homes in terms of the spatial and the environmental considerations, daylight, living space, simple things like storage space, but sort of micro level of design that is also as important as the macro issues that we need to address. The image here that I've put up is of a scheme that we're currently developing in the early stages at Lancaster for the City Council to create it's all age net zero carbon community. That's about 450 homes, apartments and later living, and a range of different housing typologies, around half of which are to be affordable. But a big, I suppose a big driver around the development of this scheme, again in its early stages, is around the social connections and promoting a sense of community. So part of the scheme, a number of buildings at ground floor level. I think we've got a total of about 25,000 square feet. It's quite a lot of active and community uses at ground floor across multiple buildings that they kind of act as the community anchors for the neighbourhood. And the design and layout of the scheme is so important in terms of green corridors and connections, in this case connections down to the River Lune, and open space for recreational use. So a lot of factors to bear in mind, and I think that as I said, there's a lot of great stuff out there. I mean, Jeremy, HousingLIN, as we know, fantastic resource platform, and organisations like Places for People, Garden City Principles, the NHS has worked very well alongside Public Health England and others. So there's some great guidance that's really helpful for projects like our one at Lancaster, also in North Manchester, to help guide some of the thinking. Sport England, as well, I'll just mention quickly, have developed a set of 10 principles around active design. So a series of considerations that really allow principles to be established that sort of encourage and enable people to lead active and healthy lifestyles.
Nigel, can I interrupt? We're having, well, I'm certainly having sound problems. I don't know whether anybody else is.
Yeah. Is it breaking up?
It's not quite breaking up. It's you're echoing a bit. Are you too near the microphone or something?
What I can do about that, potentially take it off I'll try to put it onto my.
Would it help if you got somebody else to share the slides? Is that?
I don't think it's the slides. If I try to put it onto my laptop camera instead, let's see if that makes a difference, because it. I do apologise, this didn't come up in testing, did it?
No.
Is that any better?
No, it's the same. But
The same.
carry on. Carry on.
I'll disconnect.
Was everybody else having problems as well, or was it just me?
Yeah, me too. I think it just started though, so I'm not sure what changed.
Yeah.
Okay. That's
better.
Yeah, that's
Perfect. Perfect. Thank you.
We were connected to something that was supposed to be better than the laptop alternative, so apologies about that. Now conscious of time, so I'll crack on. In terms of the, I wanted just to mention briefly the Design for Life work that we've been doing, which is in conjunction with our colleague Mark Hammond from the university here. So the Greater Manchester Ageing Hub developed alongside as Nicola has mentioned, the framework for creating age-friendly homes in Greater Manchester, and that 3-year strategy. But we've just looked very much to put together a publication of some thoughts and short case studies for everyone involved in the built environment and to deal with aging society and addressing changing needs and aspirations. So I think it might be in the chat. If people would like to take a look, then please do. So moving on to a short sort of case study overview of the work we're doing with Michelle at North Manchester. I think, as Michelle said, the scale of investment is huge, and it gives an incredible opportunity to look at levelling up and the chances and outcomes of local people across the north of the city, and the development as a catalyst really for that part of Manchester. So the ambition for us is to create a mixed use, vibrant place with a strong sense of community, all about social inclusion and community and healthy aging. So it really is, an exciting project to be involved with, and we're delighted to be looking at this with the trust and development partner Bruntwood. The site is overall it's 27 hectares in size on the edge of the Irk Valley. And the hospital was first developed in the mid-19th century. And there is a collection of 3, you can see in the middle here, and over here, there's 3 collections of historic buildings. None of them are listed, but clearly of some architectural interest. The site's really well connected, so there's a number of local amenities, shops, schools, Crumpsall Park nearby, all within short sort of 5 to 15 minute walk from the site. So a really well connected site. Just to give you some context, Crumpsall Park mentioned here, which is going to be a key driver for us going forward. We are one of a number of architects involved in the site, with others being involved in the hospital, the mental health hospital, and some other parts of the development. Our focus is very much on 18 acres, which comprises of this site here, which is highlighted, and also this site here, which is highlighted, which are either side of the village green. So 2 parcels of land connected to one another by the village green, and there is that's really the basis of the opportunity. Our work is at a relatively early master planning stage, concept level of design. So the work that we have been doing, symbolised initially by this diagram, which is looking at the range of proposed uses across the site and the various relationships, the dependencies and interactions between the uses, with I think really an emphasis upon the connections and the interactions between what's going on. So our involvement, just to be clear, is on the housing, which is the blue components, and the healthy aging in the orange colour. So we gradually built up our thoughts via diagrams, looking at the build-up of our sort of design thinking to do with connections, the public and private routes, the green spaces and a hierarchy of spaces, which allows us to look at
building frontages and activity, and how you might start to think about arranging buildings, scale and massing. So I think, as Michelle's mentioned, the site fronts onto or backs onto the adjoining housing, which is smaller scale. So the general principle is smaller scale at the edge, gradually increasing towards the centre. And then out of that come a series of diagrams that illustrate how, with those connections and routes, how we start to evolve buildings, and how those footprints of those buildings might start to come together, integrated with green spaces and connected green spaces, which is then diagramized, I suppose, in this slide, which is looking at what we've called, we work with Gillespie's landscape architects here as well, looking at the sort of public realm and landscape-led approach, whereby we're looking to weave into the scheme a health and well-being corridor through the site from Crumpsall Park, which is at the bottom of the screen here, through the site to the village green, and giving a series of spaces really for people of all ages and backgrounds, whether it's staff, it might be patients, it might be residents, local community, to come together, to mix, to relax and enjoy the outdoor spaces. And then it's around these spaces that then the buildings are arranged. So we have here a diagram which was put together as a zonal diagram to try to work to understand how the various parts of the scheme might be broken down, looking at networks of spaces from public through semi-public to private. The southwest parcel of the site is in the diagram down here, so this is the healthy neighbourhood, and then to the northeast of the site here with the commercial and some more residential, where we have some employment alongside, and also housing for key workers. That's then sort of transposed and started to develop into buildings. So we're starting to see some footprints coming together now of how the scheme might come together. So roughly 450 homes across the site, about 100 or so care facilities for household beds for people with needs in later life, a community facility, quite a large area of commercial space, and obviously the open space that knits everything together. Then looking across the site, we've done some sort of initial modelling to look. This is a view looking west across towards Crumpsall Park. You can see different scales of development, the family homes which are backing onto the neighbouring residential, commercial in the foreground, and reuse here. You can perhaps just see here reuse of the existing 19th century buildings for key worker accommodation potentially. And then a view looking back the other way towards Crumpsall Park. I think you can start to see now the sort of sequence of green spaces and the strong route connections that route through from the central village green through to connections to the park. So sort of a network of spaces now starting to emerge as the design develops. The next few slides really just using a selection of our projects to just illustrate some of the intent, if you like, for our thoughts at North Manchester. Placemaking is key. You know, it's at the heart of the master plan, putting people and their health at the centre of how we design and use public spaces. The residential buildings are designed to define and sort of overlook the spaces and making them feel safe, accessible. There's a variety of green space proposed. We've got private gardens, semi-public, playgrounds, for example, to encourage activity for the young, and therefore providing a sort of safe space for all and the opportunities for various community activities to take place. Also really key is the legibility of the routes and connections through the scheme, and activating those routes with amenities, so ground floor community and retail opportunities. The public spaces then work off those spaces and it creates activity and life within the neighbourhood, and also opportunities for consideration around healthy eating options, whether that's local grocery stores, it might be promoting affordable healthy lifestyle choices. So everything's starting to work together to work in the same direction, in terms of that healthy neighbourhood concept. Also, private spaces. You know, there are different building types that we're looking at on site, and we need spaces that are aligned to each of those uses. Here, just an image of a project with one of our very forward-looking clients, Belong, who develop care facilities for later life. Sensory gardens, in a sense. So, you know, different types of spaces. Green roofs, we're looking at for creation of additional recreational spaces for residents, and potential for the green roofs to also contribute to the overall sustainability ambitions and strategy for the site. And then to sort of wrap up, what I just wanted to highlight, I suppose, another dimension to the healthy neighbourhood, which is it's all to do with the vision for the neighbourhood as an exemplar for healthy ageing. So creating an environment for healthy ageing businesses to establish and grow the commercial space, to include sort of research, with the centrepiece potentially to be the International Centre for Action on Healthy Ageing, which Michelle has mentioned, which would provide a huge opportunity here for work on advanced healthcare collaborations, and the research on site as a living lab type analogy, that connection between a commercial and residential development, promoting significant forms of new healthcare that can be trialled and developed, and the all-important in-operation feedback that will come from residents and healthcare professionals alike through research agreements and helping to evaluate the interventions that enable well-being and the avoidance or minimisation of hospital admissions. Also, I think on this slide, just want to make the point about the importance of developing an architectural response that responds to its landscape surroundings and woodland setting. At North Manchester, we have the north and east of the site are wrapped in some wonderful woodland with long distant views. But the opportunity there to use natural materials in a contemporary fashion to sit the development comfortably in its surroundings, and again sort of embody that healthy neighbourhood feel. So as a team, we now look forward to sort of developing these ideas into sort of more formal proposals for the regeneration of the site. And I think the ambition here is for a world-class healthy neighbourhood that really makes a big difference in North Manchester. So thank you for your time, and apologies for the acoustic difficulty.
Great, that was fantastic. Now I want to be an architect.
Not a sound technician.
Well, it didn't last too long, Nigel, so don't worry about it. No, it was fine. That was great. That was fantastic. I mean, placemaking is so important and having that spatial vision as well, and vision for the future, which is, the whole ecosystem and all the connections between function and form and so forth. So that was fascinating, and good luck with the ambition to be an international centre. Lots of challenges there. So we've come now to the part of the session where we're open for questions from you, the audience. I've picked up 2 questions, which I know Nicola and Nigel have already answered, but I'm going to go back to them because I'm wondering if any of our other speakers would like to contribute to them, or if Nigel and Nicola would like to elaborate further. Do put more questions in the Q&A. We've still got time to do that. And the first question was, how important is co-production to creating the optimal condition for health in our homes and communities? Can we ever achieve human flourishing? I love that kind of term, for the majority versus the minority and the good society without overcoming inequalities and enabling rights to health for all? Quite a challenging question. Nigel, would you like to elaborate?
Yeah, may I come in on this? I have to apologise to the questioner because I didn't realise that my answering it made it go away. So anyway, and I'm afraid I'm going to have to go in about 3 or 4 minutes. So that's why I thought I'd try and come in first. I think there are 2 points here. I mean, the questioner is absolutely right. You need both. But I think the presentations I've just listened to have been fascinating. And I think the last one with Nigel talking about what are the conditions for a healthy neighbourhood, it makes me think that what we need to do is to, if you agree with my little syllogism, as it were, that says, you know, healthy individual needs to be part of a healthy community, needs to be part of a healthy society, needs to be part of a healthy planet. Well, Nigel's told us what a healthy neighbourhood or a healthy community looks like, all those sort of things. And I think when we think about a healthy society, that's when one comes into all those aspects about inequality and how society is structured, as opposed to how a community is structured. And we need society to be structured in the way that this questioner sort of says about equality of opportunity and, well, dealing with inequalities and other issues. And we need to think about all of those. So I'm going away to think about that. So I thought it was a useful question because, yes, none of this is just a single answer, is there? This isn't a Harry Potter moment where you can wave a wand and stuff happens. It's much more complex than that. So thank you for that. And my apologies that I actually need to go now.
Well, thank you, Nigel, and thank you for your presentation. It was superb. Thank you. Thanks for joining us. Would anybody else like to pick up on that question? No? The one about co-production? Okay. Let's go on to the other one. So this was a question for Nicola. How are you engaging with developers to forward healthy aging? And I think this raises a bigger issue, which you've all touched on, and that's how do you balance different stakeholder views in all of this? I mean, you've talked a lot about participation of the community, developers, etc., etc. How do you balance all of that when you're actually trying to create a healthy environment? Who wants to have a go at that? Nicola, do you want to start? Because I know you've, yeah, great.
Yeah, I mean, and Nigel might want to comment on specifics because I feel like Nigel Saunders, although the other Nigel has now left, does a lot of the groundwork in Greater Manchester on this in terms of our developer roundtables. And I guess it's more what I would add to my written answer is acknowledging that it is a challenge. I think what we're learning as we've been working on this framework and talking to different stakeholders, and I think you hear this a lot from colleagues who work in communications, but is the importance of differentiating your stakeholders and really understanding kind of the kinds of messages that you need in order to influence them. And yeah, I will pass over to Nigel, but I think one of the things we're doing that I think is really interesting is just creating that space where there can be dialogue and conversation, and it's amongst developers, and it's a kind of, you know, developing that rather, you know, just offering that space where they can come together and ask questions and learn. But I'll pass over to Nigel on that.
Thanks, Nicola. Yeah, I think really, you know, we're taking the approach that almost asking ourselves the question: how do we promote and encourage developers to look at the world, I suppose, a slightly different way? And I think in its favour at the moment, I think is a really wide awareness that the need to develop communities rather than, I suppose, residential developments for restricted groups of people is so much more important. So whether it's providing a social value sort of angle to developments, or whether it's to do with just the sheer volume of opportunity that there is in creating environments for all ages, is where I suppose the two things are coming together. We've got to, and I don't think we're actually finding it that difficult now to start to engage with the wider development community, because it is becoming such a topic of interest for people. So I mean, our approach has really been to use the connections we have across GM to talk to the people we know are interested in pursuing these things further. and it very much is a partnership, isn't it, Nicola, within the city region. There is an ambition with Manchester as its World Health Organization status as the UK's first age-friendly city region. The ambition is there, the will is there, the sites are there, and whether it's North Manchester or whether it's Victoria North or whether it's smaller scale developments, we're having some really useful roundtable discussions involving not just developers but also town planning consultants, agents that operate in this field, and out of that is coming a greater understanding really of what things need to happen. And I think we're in a unique position in Manchester where together the network is there to make things happen.
Yeah, I mean, it's a great example. I mean, an international example, I think. Fantastic work, and hopefully it's been evaluated at every stage, really. Another question's just popped in the chat, and I think it relates mainly to future-proofing in some ways. Designing for the current and possible future pandemics, any thoughts? And I also got a question which is slightly similar, not necessarily around pandemics, that's one specific thing, but how do you accommodate sort of life course changes? And I'm thinking particularly here about, people who might go on to develop cognitive impairment. How inclusive actually are the developments to really take into that flexibility then for the future, whether it be pandemics or as a societal kind of life course or individual life course through different disabilities and cognitive impairments.
I could perhaps just start with that, Judith. In terms of designing for pandemics, I think that there are implications to design that we're starting to grapple with. You take apartment living, for example, that during times of lockdown and even more sort of agile working that we're now using frequently, there is the need for homes to have more flexible spaces, more flexibility. In apartment design, for example, to be able to have maybe shared spaces which are small for taking Zoom calls, whether it's flexibility in terms of layout and segregation of space. So different types of spaces, and perhaps also slightly larger homes to meet those needs. I think family housing, the garden has become a real item high up on people's wish lists as their families grow, and to have some external space. So provision of balconies, perhaps in urban environments, becomes more important.
Great. Anybody else want to pick up on that? Jeremy.
Yeah, just to add to what Nigel's saying, in fact, we work closely with both Pizzoni on an extra care toolkit, looking at cost modelling and again building that in, how to create both the public space and the communal areas, as Nigel referred to, but also how to maximise safety and security and people being able to sort of defend their space as well. So that became very important, and what that means also is how does that relate to both future costs for adaptability of our existing stock, but also for new homes as well. So whether it is Wi-Fi now and digital connectivity, I think Emily talks about inequalities. We've also got significant digital inequalities as well out there. So we need to start really having a new thinking about the design, and it may be linked to some of the things that Nigel Crisp said, this sort of a holistic salutogenic sort of approach on health creation, and perhaps that sort of work he's doing to try and influence the bill that's around, which in effect is looking at future building safety. We need to think about our own safety within that context as well, and it's not just the cladding or the physical form.
Mm-hmm. Yeah, good points. Nicola, do you want to come in?
Yeah, thanks, Judith. I think what that's made me think about in relation to Greater Manchester is just to, I guess, also reiterate in relation to that theme of needing to, involve or engage. I feel nervous about which word to use now after the earlier presentation about engage, but to listen to the voices of how, you know, if we're talking particularly about pandemic, how people were affected by the pandemic, and that, you know, includes doing kind of the research on that. We did a piece of work last year in Greater Manchester with the University of Manchester that really engaged with the experiences of groups that were particularly marginalised or socially excluded, and what their experience of older people and what their experience of the pandemic was. And I think what this conversations make me think is, have we joined up that piece of research with our thinking around homes and housing, which is one of the advantages that something like the Ageing Hub, a partnership or arrangement, has, is that bringing that integration of the agendas and the research around people to understand the kind of different ways that we might be able to kind of mitigate or build resilience. So I think it's a really helpful question, but I guess the maintaining the emphasis on listening.
Yeah, I think that's one of the big messages, I think, coming out from this afternoon, that co-production, co-design, and not just with older people, but, you know, the whole range of stakeholders. We've got a few minutes left, and I know Jeremy wants to say a few words at the end. We haven't had any more questions in the chat. One thing that's really struck me about everybody's presentation, the great photographs and slides everyone's had. I mean, that's always the advantage of coming to the HousingLIN sessions. There's always good photographs and pictures, and really brings things alive. So thank you so much, everybody, for preparing such great slides and really taking us through all of those. And I think you've drawn out some really good sort of tips, really, for placemaking for all generations. And I think that's really key. And I'm going to ask you, I'm going to go round to you to say, if there's one key message you'd like the audience to take away from this afternoon, what would it be? What would you, having heard all the presentations, what would you like to say? And I'm going to be really naughty here. I'm going to start with Jeremy.
No, that's absolutely fine. I think somebody said about listening, and Nicola, I think you said something about listening. I think it's really important to listen to the local community and let that shape, and it goes back right to the heart of that co-production and co-designing element. So I think for me, it's about listening.
Great. Michelle, do you want to have a punt at this?
Yeah, thanks. I guess for me, it is that link between the hospital and the housing to explore in a bit more detail. You know, New Hospitals Programme are encouraging us to say build as small a hospital as possible in terms of that kind of call on the public purse. But I guess what else do we need then in terms of supporting the other side of that and the left shift that everyone talks about? Otherwise, on day one, the hospital will be too small because the other stuff hasn't happened quick enough in terms of that different way of delivering services. So yeah, I think that's a challenge that I'll still be thinking about.
Great. Nicola.
Thanks, Judith. I think I'm also going to take listening, but I think I would expand that to all stakeholders. I think that's something I've really learned. We've just covered that conversation about developers, but it's not just around them. Where are people starting from that you want to influence and to change their behaviour? And if you really have to understand that and what their priorities are in order to kind of build those effective partnerships.
Nigel?
Thanks, Judith. I think it's, I think big consideration is around when we're designing and developing and promoting perhaps larger scale housing developments as mixed use schemes, that we really think about what makes life good for people. So it's about the whole person. It's about social life. It's about cultural life. It's about how we create community, families, how they can contribute in so many ways. As a society, it's a microcosm society, and I think for too long recently we've been developing solutions which really focus on a particular age group or type of person. I think we're learning more and more that we need to get back to the basics of creating communities You know, people want to live active lives, quiet lives. They want to be educated. They want to work, and it's how we create that whole sort of community feel in our developments and thinking.
Right. That's a fantastic point to end on, I think, and that ecosystem, that holistic piece, and talking about relationships in everyday life, and that's what it's about at the end of the day. Jeremy, I'm going to hand back to you because I know you want to say a few words, and I'd just like to thank everyone on the panel for a great discussion this afternoon, great presentations. Thank you.
Judith, and on behalf of the panel, can we also thank you? And I was also going to ask you, what's the one thing you want to take away?
Well, a whole range of things, but one of the major questions I was thinking of is how does this translate to other sort of, well, not just urban areas, but rural areas, coastal towns, and the non-urban areas, and some of the things that we've learned. So that was one thing I'm going to follow up on.
Yeah, no, that's great, and that sort of links back to the first session we ran, which was also address some of that levelling up with Create Streets Foundation, and trying to think about what's the term "no place left behind." So I really like that. So it's a good link. But I think just in terms of my summary, I hope you all agree we've had a wonderful week of learning, and obviously that's very much what the HousingLIN is all about. But it wouldn't have been made possible, as I said earlier, without our sponsors who've enabled us to put this on for free, but also to everybody who's contributed. So again, on behalf of the HousingLIN, to today's presenters, thank you, and for everybody else who's shared their time with us over the other 10 summit sessions. Can I also thank all the participants, many of whom actually have joined us along the journey for each of those sessions. And I know that there are a handful who signed up to all of them. But many of the participants have also participated with the LIN over the last 10 years. And can I thank them for also enabling us to sustain our services and for the support they've shown both pre-COVID and as well during COVID. And that's enabled us to continue rolling out what we hope is high quality learning and improvement resources. If this is your first time with the LIN, please do sign up to our regular newsletters and our bulletins, and some of you may have come across our happy hour sessions. We look forward to rolling those out in early 2022. And if anybody's been inspired by what you've heard, please do share with us your thought leadership or an example of practice in your locality, because as Judith says, we do like sharing a lot of information and also using this not just to enable our networks to grow, but also as a catalyst for other networks and other communities of practice to share and understand what's happening within our sector. But lastly, I want to again come back to thanking Judith and the team for presenting today. Thanks ever so UKRI and Pozzoni for your support for this particular session. Can I also thank the team behind the scenes, and particularly Jerome and Sally, who've worked really hard behind the scenes, not just today, but in the lead up to running a session. I know when I said to them we're going to run it over 5 days with a number of webinars each day, the eyes started to roll, but I think it's run fairly smoothly. We've really enjoyed ourselves. In fact, time has flown by really quickly. So that all leaves me to say, can I wish all of you season's greetings. Copies of the recording and the slides will be available next week, and please do continue to be engaged with us. We look forward to sharing more learning next year. So all the best, and thanks again for all your support.
Thank you, Jeremy. Bye, everyone.